Hi, my name is Donnell Buggs. I'm the Director of Bigger and Better Business for Kappa Epsilon Sigma Chapter of Phi Beta Sigma Fraternity, Incorporated. We're here today to spotlight a gentleman who's been doing some great things. He's a podiatrist. His name is Dr. Frank Oware-ree, and he's going to give us a little bit about his background and just talk about some of the services that he provides. So, Dr. Oware-ree, welcome, and thank you so much for meeting with me.
Thank you. Thank you for having me.
Sure. So let's jump right into it. So, studies show that there's only about 2% of the US population that's made up of black podiatrists. So you're one of that 2%. So I'm curious to know, how did you become interested in pursuing the field of podiatry?
Wow. Giving myself that 2% sounds meaningfully low, and I think we need to bring those numbers up because there are a bunch of us out there that can do the profession proud. But for myself, I was a soccer player. So growing up playing soccer in Africa, that was it. That was the talent I felt I had. And my mom will always say, "Yeah, what happens if you get hurt?" And to her, that meant everything. What happens when you get hurt? So if you don't get straight A's, you do not get to play soccer. Now, granted, I thought I was good because I had scouts come out and watch you play, watch your practices, do all that stuff. So it's like, yeah, I'm going to make it in soccer. Then I got injured.
Wow.
Right. So my mom's initial fears primarily come true. But for me, in the household I grew up in, you have to study first before you can play. So while it was difficult to kind of leave that kind of career or dream of that career on the side, it was like, okay, if this injury is going to happen to me, that means it happens to almost a bunch of young kids out there that have the skills, have the knowledge, work hard, but this injury is going to set them back. So how can I help with that? And that kind of started a journey for me for, okay, how do I do that? In which world can I contribute to fixing ankle problems? So that's where it all started. And then from there, going through high school education, college. College was the first time I really kind of got introduced to, okay, what am I going to do with my life, right? And it was kind of interesting looking at the Department of Labor and Statistics and looking at where to have it, where each career kind of goes and what to do to get there. That was the key thing for me to kind of, I don't think back then the statistics were 2%, but I looked at it more like I can help younger or other people with my type of injury. And then from there, visiting doctors, shadowing a couple of guys, and in shadowing was where the exposure to, oh, okay, I can do this. I think I can do this better than anybody, at least that I am looking at. So that was it for me.
Wow. And so what a lot of people might not even know, that you have been nominated as the top doc for a number of years. How many years were you nominated?
Wow. I usually don't like to talk about these things, but at least 3 years in a row, probably going from 19, 20, 21. I'm not sure of. It could probably be earlier than that, but South Jersey Magazine has this thing, and whilst to me it meant, okay, but at some point it kind of indicates patient satisfaction, right? Because it's by your patients, it's by people out there that get care. So I would say, okay, we appreciate it, but the work is not done, and so being top, it's cool, but we can do better.
cool.
Right.
That's how you describe it.
Yes.
To me, that's amazing, you know, because it's a testament of your contributions to the field. You know, I think probably patient satisfaction is a huge portion of it, but I'm pretty sure that it's also like other achievements and things which we'll get into a little bit. One of the things I'm curious to know from you, though, is that you also accomplished something that was significant in the early part of your career as a resident. Can you talk a little bit about that?
Well, I think for medical education, I think we tend to like structure. And so having good structure in any training system allows you to kind of, one, build confidence, and then two, be able to do stuff under stress, right? So leadership in a training setting kind of tends to fall that way in medicine. So it was interesting, at least earlier on for me at that point, to be chosen as the residency chief resident as a second year, and as third year, because residency is 3 years. And so when you're second year, that means there are other people you look up to in the third year, but to have to lead from second year is kind of as hard and difficult, as you have to correct other people's training and guide them in what they need to do better. And so to do that was hard, but I think it was something that I was excited to try, and that was probably, I would say, the hardest thing I ever did, but it was also the most rewarding thing, because after those 2 years, I don't think there's anything in my field that is kind of beyond understanding or dealing with.
Wow, that's amazing, amazing. So again, a testament of your contributions and the great work that you've been doing. What would you say have been some of the pros and cons of being a podiatrist?
Well, I mean, the pros are many. Honestly, it will be difficult for me to figure out cons, because I think it's all pros, right? And I say pros when I talk about flexibility. All of us earlier on in our career usually have narrow focus of me, until you have kids. And then when you do, you then start to realize the best job you could do is bringing your kids up right. And so if your kids are right, you sleep better. And so one of the things about, I think, podiatry that most of us in the profession kind of keep as a secret is the flexibility to, at some point in my career, I was more like in the operating room from 7 to 5, in the office till 8.
Wow.
But then my schedules are able to kind of change based on what my family needs, right? So one of the things that is super important to me is, for instance, my kids' soccer game. I don't want to miss any one of them. So the flexibility of, hey, being able to do my job to the best way I can, be there for my family, see the kids, that as you get matured in life is super important. And that is one of the biggest flexibility things. So flexibility, there are different ways to practice podiatry, which is, I always make fun of my colleagues in other specialties are saying, like, you can get very narrow. Podiatry kind of has so many different tracks, right? So if I'm interested in, say, for instance, wounds and the healing of wounds and infections and stuff, that track is available every day,
Gotcha.
both in the hospital and in the office, right? If I'm available, or if I want to just look at just doing reconstructive surgery, that track is available in my training, right? If I'm interested in doing gait, which is watching, walking, injuries, sports, that track is available. And it does not necessarily require me to retrain all over, because part of the training curriculum makes room for you to have all that.
Yeah.
So all that flexibility kind of sets you up to be more like, okay, I don't have to be locked into this thing where if I'm not happy there, I gotta quit and go back to school.
That's right.
My focus has room to change, right? So as an example of myself, I started doing it. I do still do a lot of reconstructive surgeries, flat feet, tendon, ankle ligaments, because that's what actually brought me into the profession.
Okay.
But over the years, the breakdown for me is more diabetes and infections, surgeries and reconstruction, and then gait and orthotics, kind of biomechanics, how people are walking, back pain, knee pain, how it relates to your feet and all that. So there's very little professional training in any other field that can give you that kind of flexibility to kind of switch.
Right.
So my schedules are always interesting, right? I never have a day where it's just one thing.
Right.
Your mind is always at work. I like that challenge.
Okay.
And so we'll keep it that way.
Keep it that way.
Cons, like I said, it would be difficult to come up with cons with my professional choice. But the one thing is always and this part does not even relate to being a doctor in itself, but it relates to insurance and allowing doctors to just be doctors and not have to think about what your patients need and what they can afford. Right. So those kind of tend to go hand in hand. I can see a pathology, or I can see something that I say, we need to fix this. If it costs $10,000 and that patient can't afford that, I can't say they're being a bad patient. Right. But not everybody's going to be comfortable enough to tell you, hey, I can't afford that.
That's right.
The way they tend to show you is usually they can't do it. So you tell them they need to do this, it doesn't get done.
Wow.
And so that's always, but I don't think that's a con for just podiatry, right? I think that's a con in the healthcare industry overall. Because in the end, healthcare and insurance kind of go hand in hand. So that's something we hope our Congress and leadership in the political world can help us kind of figure out some of these problems, so we can have a better healthcare system.
Absolutely, and meet the needs of the people.
Yes.
Right. Okay. What would you say are some of the specific challenges or barriers you have faced or observed as a Black podiatrist in the healthcare industry?
One of the primary things for me has been, I originated from Ghana, so shout out to Ghana.
Shout out to Ghana.
Shout out to Ghana, right? Originally from Ghana, and one of the things for me coming from, you could say, third world country, which I don't think in Ghana we think of ourselves as we're third world country, but coming from Ghana to America earlier on, in my early 19, I was about 19, 20. Coming at that age, one of the things I saw was, there being a doctor, my parents need to have money. Here being a doctor depended on what I had in my head, or how much work I was willing to do. So my father will do like 3 jobs, right? And one of the things he always said to me early was, here, they can try to say whatever they want about you, but your results will speak for themselves. So if you put in the work, especially what I now say in a capitalistic world where everybody wants the best talents, forget about everything else and let your talents kind of show through, right? So one of the things for me in podiatry was figuring out or getting exposed to it to then be able to let my talents show. So one of the funny jokes I always tell most of my friends is, my wife is also a podiatrist, right? And we both applied to med school or podiatry school out of college. We both went to Rutgers.
Okay.
Right. She had no clue about that field. She had already had admission to a dental program.
Okay.
So that's where she thought she was going to go. Now here I was, I had done all the research. I applied, I went for my interviews, and yet with my better grades, with better letters of recommendation, and better body of work, because I did a lot of volunteer work and working in a bankrupt system with kids with neurological disability. I personally thought that was huge in helping me develop as a person in that kind of helping kids with disability. So that was huge for me. So to me, that said, I'm a better candidate than everybody. That was how much confidence I had in myself. Now you say obstacles, what I thought was, so I give all this information on my research to my wife, who was my girlfriend at the time.
Okay.
And she decides, okay, I like the research, so I'm going to change my mind and I'm going to apply and see what happens.
Okay.
So she applies, she gets an interview, goes for her interview a week after me, and then within 2-3 days of the interview, she gets a letter of acceptance, and I'm like, what's going on here, right? So in that moment, it's more like, okay, it's what I perceive as why, what's different. Is it great? Is it, name all the factors. But then, like my father always kind of just put in the work, I just picked up the phone and called to ask questions like, why is that so? What's the point? 2 days later, my letter again came in. So sometimes you have to advocate a little bit more, right? So that was key, and those little things you will encounter those along in your career and stuff. But I think those are obstacles that you just navigate and just keep your calm, and usually society kind of corrects some of
Correct
those
itself, yeah. But make sure that you're also, like you said, be your own advocate,
Yes.
right? Speak up.
Yes.
Okay. Can you discuss any advancements or emerging technologies in the field of podiatry that may interest or excite you and may impact your practice in the future?
Wow, so that's a big question, and that's a humongous question, right? Because we've gone from anything that's infected, kind of cut it off, especially in our diabetic populations, with a lot of what you would call like diseases that we didn't even know much about before. For instance, most diabetics will tend to develop something called Charcot, which is it's not an infection, but it's an inflammation that affects joints in the foot. So those patients will see their feet changing over time with like a bottom that ulcers, too much pressure in one area or the other, right? those are very difficult. We tend to used to think of them as infection and cut their foot off. Multiple innovations in technology and how to fix some of these problems have all, as with each month, we are seeing newer equipment or new techniques, new treatments, and those are all affecting how we're treating patients, right? Those are affecting the kind of care patients are getting. When we say future, it kind of gets me excited because I think earlier on I was talking about, for instance, nanotechnology in how we see pathology in general. Because when we say podiatry, usually most people kind of start thinking about your feet, but your feet is connected to your body, and the diseases that affect your feet and your legs in general that I see are diseases that are coming from diabetes, from infections, from bacterial infections, so many different injuries from sports, from motor vehicle, from all these, and so having technology in general that affects some of these diseases. For instance, we were just talking about nanotechnology with having blood particles that can change your insulin and help how your body regulates. I get excited about that because that means my diabetic has a better chance of fighting their infection if they have it, and I have a chance of saving limbs rather than cutting them off.
Wow.
Right. So those are exciting in that. We are learning more and more about medications, right? Medications in different forms that just helps us prolong our patients' lives, right? We see depression and stuff all the time. And when somebody has an infection or you cut off their limb, it kind of, we should be able to see the link, right? The link there. Somebody whose leg is cut off is not going to be excited about the future, but if we can preserve some of these limbs. So being able to learn these techniques or these medications, improve and pass that on to our patients is huge. I used to be the assistant residency director at Jefferson, and in training younger doctors coming through, and like we talked about, priorities change once you start to have kids, right? Because being assistant director kind of meant more time dealing with other stuff, but once I had kids, I had to kind of give up some stuff to have more time.
Right.
But those applications for my residents, I always say my residents, because once an educator, it's in your blood.
Right.
So all these, we can talk about that like all day, and my wife would probably say you don't want to talk about that because I just keep going and going. Right?
No, that's excellent. And we talk about like advancements in the future and contributions. What is your vision for the future of podiatry, and how do you plan to contribute to the field's growth and advancement?
Well, so advancements are always interesting. The newest buzzword is AI, right? And I think for better is going to help us be like more efficient, and more efficient as in it's one thing to see my patients, it's another thing to deal with all the I would say paperwork and insurance and mobilizing data and figuring out what works and what doesn't work, right? The human mind can process information to a certain level. Even the smartest amongst us, take the Elon Musk's and stuff, can process information at a significantly faster pace. But an AI system can do 1,000,000 times better than Elon, right? So imagine me having access of to that kind of information and saying, hey, Mrs. Jones has this and that and that, and so how does this medication affect what I'm thinking of doing with her, and the outcomes, and being able to take, for instance, then take Mrs. Jones's particular pathology into a virtual world where before I even do any type of surgery, do that in a virtual world before it's attempted on her, which means her surgery, her particular surgery, I've done before.
Yeah.
Right.
Yeah.
So technology is important. It's got pros and cons, but I think if we manage the pros, the direction we're going is huge.
It's huge,
So,
absolutely. Now, you've already started some advancements. You have also put together some products to help patients who are dealing with different types of issues. Can you talk a little bit about that?
So one of the things that led me on the track of trying to try to make things more affordable for my patients, right? So one of the things I see is almost all the time patients come in, and as a physician, you look at people and you say, okay, you need this kind of thing to help solve this problem. And we tend to think as doctors, that's where our participation starts and ends. What I was, however, noticing was we then put patients in categories of this guy is non-compliant, this guy's, and in those instances, everything kind of tends down to cost for my patients, right? So I look at, for instance, compression socks, which from my perspective as a podiatrist and as somebody who sees muscles, veins, arteries, and nerves, everybody over the age of 30, 35 should be wearing compression socks, right? That is how vital just wearing compression socks reduces your chances of vein diseases and improves circulation, improves muscle performance. So when you see these athletes with those compression, whether fancy colors and stuff, it's not just because it looks nice. We know its benefits. Now, how do we translate that for our patients? From a translation on that part of it, as doctors tend to say, here, go get this. But in looking forward and looking into, like I was saying, I think earlier on, I had a patient that just came in and said, hey doc, you told me to get this thing. I went and got it. It cost me $75 for one compression sock. And your mind starts going.
Just for one?
For one pair, right? And so he says, how many do you think I need? I say, you need to wear it every day. So I would say get maybe 5 or 10.
Wow.
And he looked at me and said, you might as well take my leg, right? Because I'm not going to be able to afford it. Yeah. So from that perspective, again, I go home and complain to my wife. She's my shrink, right? I go in and tell her everything that bothers me. And she said, you know, what can you do something about it? And that was, to me, a challenge to do something about it. So researching materials that will last longer, that can generate that kind of compression, and the most important of it, cut the cost for my patients, kind of led us to kind of come up with what I call foot culture. Right? So it was a funny process of trying to figure out what to call it, and then finding out the domain name foot culture is not taken, and doing all that. It helped me learn more about technology and all that, but learning more about fabric, what works, what doesn't work, and what will last. So foot culture led me to come up with a compression sock that I'm wearing one today, right now, as I'm sitting here, because I was running out, right? But where developing that was huge. We talked about skincare for my diabetic patients and for all of us in general. It was interesting. Every time you get weather changes, skin dries, and again for compromised immunity in diabetic patients and people that have dry skin, that's one of the factors that leads to infections, right? So it's like, how do we avoid that? Now we say, go get this, go get that. All those products also have stuff like ethylene glycol, which has got nothing to do with your skin. You have antifreeze in some creams, which has got nothing to do with your skin. Alcohol products, which has got nothing to do with your skin. So it was, how do we make something natural from earth that will help keep you dry, that will not cost an arm and a leg, right? So that was a cathartic experience for me, because I was in Africa, I think a few years ago, or less than a few years ago, and getting back with my roots and saying, hey, I'm from Ghana, okay? It's dry, close to the equator, Sahara Desert, around those areas. How come my ancestors, my grandma, how come they don't deal with those type of infections? How come those of us here in the most developed world have those problems, and yet the products to take care of those cost like $50, $70, $200 for a cream.
Even more, right?
Right. So that's what led me to kind of come up with the creation of a cream or a lotion I call Factor X. Mainly because the X is more for all the 10 X, as in the 10 factors, right? All the 10 things you can get from this particular cream that is good for your skin. My kids actually joke with it. We'll put that in their mouth, because if they put out a lotion in their mouth, I'm going after them, right? You see my son put it on his hand and put his hands in his mouth, you know.
Well, it's natural.
Yeah, so it's all natural, right? So from shea butter, coconut oils, some essential oils, all these are natural stuff that we eat. So how do we get it to a certain chemical bonds that is good for your skin? That was interesting, and I do post some pictures of how I make them and stuff on Instagram and stuff. So all those, so those are some of the little things that have kind of taken a life of its own outside of medicine, but it's a good escape from dealing with disease and pathology, right?
You're actually creating solutions, right? And answers to the problems, not just contributing to the problem. So that's awesome. So if a person was looking for a compression socks or the Factor X for dry skin, how would they order those or get that from you? How would they?
So we have a website that is foodculture.com that all these products that are in either are already on that website or still in development are all going to be there. Some of those, the compression and the Factor X, are even on Amazon. They'll be at all the Cornerstone Foot and Ankle offices. There is a few actually. Dr. Carpo is one of the doctors who has already reached out and has it in his office. So the word is getting out there. It's kind of, we'll see how that goes, but the idea is to generate more cleaner, more healthy, no chemical kind of products for our patients, all natural.
That's amazing. Now you said that it can be found in all of the Cornerstone Foot and Ankles, right? Today we're actually at the Marlton office of Cornerstone Foot and Ankle. But you're also in other offices as well.
Yes. We're in Sewell, in Cherry Hill, in Mount Holly, in Pennsville. So
All over.
yes, it's all over. It's all over, and it's one of the great things from my partner in crime, Dr. Robert Workala. He's like a big brother.
Okay.
His vision and knowledge of the future kind of has allowed me to primarily do all these things whilst not having to worry about. So I call myself the kid in the group. I get to do all the different things, and then the adults get to take care of all the
adult things.
The adult things. So yes, that. But he's one of the greatest men I've ever met, and in the path he's created for Cornerstone to grow. So,
Absolutely. Yeah. What's his name again?
Robert Workala.
Workala?
Yes.
Okay, so
Yes.
shout out for Dr. Robert Workala. Workala, right?
Yes.
Awesome.
Yeah.
Dr. Oware, last question for you. You've been sharing a lot of great information. What advice would you give to aspiring Black individuals or just people in color in general who are considering a career in podiatry or healthcare?
So, the biggest and important advice is always knowledge, right? Like you started with 2%. What is the ratio of us in the general population, and if there is so few of us, how can we take care of ourselves, right? Medication development, healthcare policy, providing the care itself can only look at our communities as one way that should influence policy only if we the people put ourselves in position to influence those policies, right? We always hope that people will change, and that when they change, we will get the benefit of them changing. One of the things my father always says till today is, if you want change, you have to go make that change on your own, right? And for our communities, we have the skill set, the knowledge, the drive, that all we need to do is not let somebody give us a chance, but to go take that opportunity, right? And so let your work speak for itself, because if your grades, your resume, which is volunteer work, it helps shapes like who we are, and it allows people to know you, right? So volunteering in our own communities, right, allows people to know, like, okay, this person is not about just talking, they do stuff.
Actually doing
right?
stuff,
And then on the academic part, look, there'll be challenges. Nobody ever goes through those with a smile and a grin on their face ever. There are days where you feel like you're not going to make it, but that is also what builds the determination that makes you drive forward. So, as much as there are other reasons that we can legitimately say, hey, the policymakers and all these are making it hard for us to do X, Y, or Z, I personally think that if we put ourselves out there, we'll always be picked first, because we just have something special. And as much as it comes through more glaringly in sports and other fields, if you look at it from that perspective, those athletes have skills, and they're only a small percentage of us.
That's right.
We have more to give our communities, and I think it's incumbent upon us to just go take it. And if you try once and you don't succeed, you try again, because if your heart is in it, you will get there.
Yeah.
Right?
Yeah.
Coming from somebody who grew up in West Africa that wanted to play soccer.
Absolutely.
Right.
Absolutely.
So
There was a different plan in line for you.
yes. Yes.
Right, wonderful.
So,
And I think you hit on a good point, because a lot of our young people, that's all they see, right? The glitz and the glamours of entertainers and,
Yes.
you know, the music industry, you know, and I think that we need to see more, or our young people need to see more doctors like yourself, lawyers and things. And so statistics show that the last time I checked, that you have more of a chance of getting struck by lightning than becoming a professional athlete.
yes.
Right? So the reality is that not everybody's going to make into the NBA,
Yes.
the NFL, you know, but also that there are other careers that are just as lucrative, and you can also enjoy doing things,
Yes.
and you're helping people along the way
Yes.
to be explored as well. So I appreciate you sharing that information. And again, thank you so much for being part of this interview. We're going to encourage you, if you haven't already, to, you know, if you don't have a podiatrist already, to look into Dr. Frank O-ware-ree. How can they get in contact with you or set appointments if they want to reach out to you?
So setting an appointment with Cornerstone Foot and Ankle, the online page of Cornerstone Foot and Ankle kind of gives you the ability to make appointments online. Just filling out which days and stuff work for you, that kind of stuff online. Calling the office phone numbers. There's a dedicated call center that can help you with insurance. And one of the things about we talked about community outreach is Cornerstone. We take almost every insurance, and we treat everybody without looking at you have this insurance or you have that insurance. So one of the things we pride ourselves in is actually being a part of our community. So outreach, going to conventions and churches and providing care, like what do you call these go to events where you can just do screening.
Right, like health screenings,
yeah,
right?
we do all that. So we take all the insurances, and so online, by phone, and we'll be able to get you in any of the office and take good care of you.
Awesome. Thank you so much. And if you want to see this interview, you can go to www.pbskus.net. Again, that's www.pbskus.net, where you can see this interview. Dr. O-ware-ree, thank you so much for your time. Thank you so much for everything that you shared.
Thank you for
I
having me.
appreciate you, absolutely. And hope to talk with you soon.
Thank you.
Take care.